Did you have a breast implant and now you are experiencing some new weird symptoms? Do you have joint pain, diffuse muscle pain, unexplained fatigue, brain fog, or memory issues? Or maybe you have been recently diagnosed with an autoimmune disease and now you are thinking, is there any connection with your breast implants? And I know that for many years plastic surgeons denied that there must be any connections between breast implants and autoimmune diseases, but now
revealed she had been experiencing health issues.
Strong warning from the Food and Drug Administration about breast implants.
Alarming news about breast implants.
There are now 573 cases.
Science tells us so much more. In this video, I will respond to the most important questions that you might have. Is it possible for your breast implants to cause you disease? Are breast implants linked to an autoimmune disease? And if yes, which one? And are silicone implants more dangerous than saline implants? And the last question, can breast implant removal help you? I am Dr. Girnita, a rheumatologist who diagnoses and treats patients with autoimmune diseases every day. So let's answer the first question. Is it possible that breast implants cause you disease? And let's begin with a historical context. In 1962, silicone breast implants entered the market. By the 1990s, mounting concerns led the FDA to remove the silicone implants from the market. But then in 1999, because of insufficient evidence linking implants to a systemic disease, they were put back on the market. However, by 2019, the FDA received nearly 2,500 reports of breast implant related illness in just 1 year. Now, considering that there are about 300,000 breast implants done every year, these numbers look quite small. But are they really? Are there only 2,500 females experiencing any symptoms, or they are just the ones that were taken in consideration and they were not told that it's all in their head and they were actually looking to their symptoms, thinking to report their symptoms to their doctors, and they were listened and evaluated further. In 2021, just before the US plastic surgery meeting in Atlanta, FDA issued a box label guideline for implants to alert the patients of possible breast implant illness. And they actually forced the surgeons to inform and get signed consent from patients before the breast is implanted. Now, over my career as a rheumatologist, I have seen many ladies that were sent to me to be evaluated for autoimmune diseases, some because they had abnormal tests like certain types of antibodies that suggest an autoimmune disease, like positive ANA, positive rheumatoid factor, positive SCL70, and others because they had multiple symptoms that they couldn't understand, and they will be discussed in this video. And some of these ladies that I've seen, they had a breast implant. So naturally, they question me if I believe the fact that the breast implants are causing their symptoms. What are the most common symptoms of the breast implant illness? The most common symptoms seen in patients that develop breast implant illness are fatigue, joint pain like knee pain or back pain, muscle pain, memory loss, brain fog, difficulties to concentrate, rashes, dry eyes, dry mouth, visual disturbances, hair loss, tingling and numbness, sometimes difficulties to swallow. But here it is what makes this condition so tricky. These symptoms can appear anywhere from immediately after the surgery to 20 years later. And because of that, there has been a lot of criticism. Many of these symptoms were actually just self-reported by the patient. So the next question will be, are breast implants linked to autoimmune diseases? And if they are, which ones? A groundbreaking study from 2018 that analyzed 25,000 people who received silicone implants, and they were matched with 98,000 controls, which were people who never had a breast implant, reported the following. Women with silicone implants were associated with a higher likelihood to develop autoimmune diseases, independent of the fact that they use this for reconstructive surgery or when they were used for cosmetic purposes. And the strongest association was with Sjogren's disease, systemic sclerosis or scleroderma, and sarcoidosis. If you didn't know, all of these are autoimmune diseases that we as rheumatologists are frequently diagnosing and treating. Now let me tell you about Sjogren's disease. This is an autoimmune disease that primarily affects the eyes and the mouth, causing severe dryness in the eyes, in the mouth, but it may affect multiple other organs like the nervous system. It can cause arthritis, muscle pain, severe fatigue, and can also affect the lungs. And if you are someone that watches my YouTube channel, you will find a lot of videos that will discuss about this disease. On the other hand, systemic sclerosis, also known as scleroderma, it's another rare autoimmune disease that can cause hardening and tightening of the skin and other inner organs. And it occurs when the immune system starts to overproduce collagen, which will lead to fibrosis and scarring of the skin and the organs. And as I said, it can affect the lungs, the heart, the kidneys, the digestive system, and it can create serious complications from Raynaud's phenomenon, that change in the color of the hands, especially when you expose them to cold weather, to, as I said, skin thickening, joint pain, and even difficulties to swallow. Now, sarcoidosis is a disease that most often affects the lungs and lymph nodes, but it can affect other organs like the joints, the heart, and the eyes. Let's see what other studies are saying about breast implants. A study published in 2019 that looked at data from almost 100,000 patients who received a breast implant, and this was the largest study to report on long-term outcomes on patients with a breast implant. And in this study, 56% were silicone implants for cosmetic reasons. It showed again an increased risk for Sjogren's disease, rheumatoid arthritis, and systemic sclerosis or scleroderma. But there are also other studies, smaller studies, that report an increased risk for lupus, Raynaud's phenomenon, fibromyalgia, chronic fatigue syndrome, and mixed connective tissue disease. But please note that these cases were not self-reported symptoms. They were actually cases that were medically diagnosed as autoimmune diseases in these clinical studies. Are silicone implants more dangerous than saline implants? Here it is a surprising fact. Studies have shown that these immune reactions occur with both silicone and saline implants. And in fact, there are similar immune responses with other types of implants like orthopedic implants or facial fillers or other medical devices. So that suggests that the material itself might not be the primary trigger. Now, researchers suggest that there might be different types of mechanisms, such as the bacterial biofilm theory. Recent studies found that specific bacteria are forming on the implant surfaces, and they might trigger the immune system to be activated. Or there is another theory that the silicone particles might actually be the one to activate the immune system, but the reality is that we still don't know for sure what exactly triggers the immune system to become active and attack the body. Let's get to the last question. And this is something that many of my patients will ask me: can breast implant removal help you? Now, many patients choose breast implants for either cosmetic or reconstructive surgery. In patients who get breast implants after diagnosis of breast cancer, these implants are important for their quality of life and for their body image. And studies have shown that women who undergo explantation, which is the removal of the breast implant, actually reported a decrease in appearance satisfaction levels and a decrease in the confidence in their body image. So this will be a very personal decision, but this will also depend on whether you are experiencing symptoms, the severity of your symptoms, and the reasons for getting that implant in the first place. So if you are having significant symptoms like muscle pain, pain, joint pain, fatigue, neuropathy, brain fog, memory issues, then studies have shown that explantation or breast implant removal might be a good option. This study from 2016 showed that removal of silicone breast implant resulted in symptom improvement in 75% of patients with breast implant illness. But when it comes to patients that developed autoimmune diseases, the results are not so great. If the patient had a removal of the breast implant but no immunosuppressive treatment, the improvement was seen in just 16% of patients. But when the breast removal was combined with immunosuppressive medications, then the results were better, and the improvement of the symptoms were actually seen in 56% of patients. But as I said, explantation is not the ideal solution for everyone, and the surgeon, the autoimmune specialist, and the patient should discuss together and decide the best solution for each patient. And now that you understand that breast implants can also be the cause of certain autoimmune diseases, you should learn more about the effects of microplastics that are all around us and their impact on your body. They also increase the risk for developing autoimmune diseases, and you will find all the information that you need in this video.